Hi, my name is Brianna Easy, and this is my final project. The Quadratus Lumborum, which is also known as the QL, is a deep back muscle that originates from the iliac crest and Iliolumbar ligament. It inserts on the transverse process through lumbar 1 and 4. The action of the Quadratus Lumborum is that it bends the trunk laterally. An interesting fact about the Quadratus Lumborum is that it got its name from the broad shape that it created. Here's one of the strengthening exercises for the Quadratus Lumborum, the side plank. Lie on your side with your body fully extended. Lift your body off the ground and balance your weight between the forearm and the side of your foot. Keep your body in a straight line and hold for as long as you can. Next are hip hikes. Ensure that your hips remain level and that you have your weight evenly distributed across. Slowly begin to raise the hip of the non-stance leg. Your pelvis should now be lower on the stance side and higher on the non-stance side. Hold this position for 2 seconds. Here's the posterior view being shown. Another exercise is the windmill exercise. Start with your feet between hip and shoulder width apart. Raise one arm overhead and slowly slide your other arm down your leg. Repeat until you complete enough sets. Here's an exercise to help stretch the Quadratus Lumborum. It's called the child pose stretch. Kneel and sit on your knees, lean forward, keeping your buttocks on your heels, and rest your forehead on the floor. Next, we have the supine twist. Lie down on your back. Draw your right knee into your chest and extend your left leg flat on the floor. Keep your left leg actively flexed throughout the pose. Exhale and cross your right knee over your midline to the floor on the left side of your body. Your right hip is now stacked on top of your left hip. Open your right arm to the right, keeping it in line with your shoulders. Rest your left hand on your right knee or extend it to make a T shape with your arms. Turn your palms towards the ceiling and turn your head to the right. Next, we have the Triceps Surae, which are the calf muscles that are made up of the Gastrocnemius, Soleus, and Plantaris. The Gastrocnemius originates from the femur on the medial and lateral epicondyles. It inserts on the calcaneal tuberosity via the Achilles tendon. The action that it partakes in is plantarflexion, which happens in the ankle, specifically the talocrural joint. The soleus originates from the fibula, the posterior surface of the head and neck, along with the tibia, the soleal line via the tendinous arch. It inserts at the calcaneal tuberosity via the Achilles tendon. It also performs the action of plantarflexion. The plantaris originates in the femur but also on the lateral epicondyle and is proximal to the lateral head of the gastrocnemius. It also inserts at the calcaneal tuberosity via the Achilles tendon. The gastrocnemius is activated by standing heel raises with your knees straight. Stand with your feet about apart with your hands lightly resting on your hips. Slowly raise your heels off the floor while keeping your knees straight. Hold for about 6 seconds, then slowly lower your heels to the floor. The soleus is activated with sitting heel raises with your knees bent. Sit down with your feet directly below your knees. Drive the balls of your feet into the ground and raise your heels off the ground. Your knees should come up in the position while the balls of your feet remain in contact with the floor. To help elongate and stretch the Triceps Surae, you can perform the downward dog with foot pedal. Begin in a downward dog, pedal your feet, bending one knee and pressing the other heel down. Switch back and forth to help stretch your calves. You can also perform toes on a wall stretch. To perform this stretch, head over to a wall, stand facing the wall, and put the toes of the foot you want to stretch up against the wall. Keeping your heel on the ground, shift your weight forward until you feel a gentle stretch to the calf or the Achilles tendon. Hold this stretch for 30 seconds. To continue, we have the glutes, which consist of the gluteus maximus, gluteus medius, and gluteus minimus. The gluteus maximus originates from the sacrum, the dorsal surface and lateral part, the ilium, the gluteal surface and posterior part, and the thoracolumbar fascia and sacrotuberous ligament. It inserts at the upper fibers, iliotibial tract, and lower fibers, the gluteal tuberosity. It performs the actions of extending the hip and externally rotating the hip in the sagittal and coronal plane. The upper fibers abduct and the lower fibers adduct. The gluteus medius originates from the ilium, the gluteal surface below the iliac crest between the anterior and posterior gluteal line. It inserts at the greater trochanter of the femur, the lateral surface. The action it partakes in is abducting the hip and it stabilizes the pelvis in a coronal plane. The anterior part is flexion and internal rotation, and the posterior part is extension and external rotation. The gluteus minimus originates from the ilium. It enters at the greater trochanter of the femur, the anterior lateral surface. It partakes in the action of abducting the hip. An interesting fact about the glutes is that the pelvis drop is a Trendelenburg gait. To help elongate and stretch the glutes, you can do the kneeling lunge stretch. Place your hands onto your knee, or you can rest them onto your hips. As you breathe in, bend your front knee and stretch forward, taking your knee into a lunge position that feels stable so that you can feel a gentle stretch along the front of your left thigh and hip. You can also perform lateral hip swings. Stand tall, holding onto a stationary object for support. Engage your abs as you swing your one leg as far out to the side and then across the stationary leg as you comfortably can. Here is one strengthening exercise in the sagittal plane, the squats. Stand straight with your feet hip-width apart, tighten your stomach muscles, lower down as if sitting in an invisible chair. Straighten your legs to lift back up and repeat the movement. Another strengthening exercise in the sagittal plane are lunges. Stand with your feet hip-width apart, keep your back straight and your shoulders back, and your abs tight. Take a step forward and slowly bend both knees until your back knee is just above the floor. Stand back up and repeat the movement. Here are two strengthening exercises in the frontal plane. First, we have the standing hip abduction. Stand up straight and hold onto a pole/post. Put most of your weight on one foot, then move your other leg towards the side while keeping your toes pointed forward. Return to the starting position and then repeat. The second exercise would be lateral lunges. Stand with your feet hip-width apart. Step out wide to the side while keeping your other foot flat. Bend your stepping knee while keeping the other knee straight. Forcefully push off from your foot to return to the starting position. The next muscle group are the hamstrings. The hamstrings consist of the biceps femoris, semimembranosus, and the semitendinosus. The biceps femoris originates from the long head at the ischial tuberosity, short at the linea aspera of the femur. It enters at the head of the fibula. The actions the biceps femoris does is extend the hips along with flexion and externally rotating at the knee joint. The semimembranosus originates from the ischial tuberosity. It enters at the medial tibial condyle, oblique popliteal ligament, and the popliteus fascia. The actions it partakes in is extension at the hip along with flexion and internal rotation at the knee joint. The semitendinosus originates from the ischial tuberosity and sacrotuberous ligament. It inserts medial to the tibial tuberosity in the pes anserine along with the gracilis and sartorius. The action it partakes in is the same as the semimembranosus, extension at the hip along with flexion and internal rotation at the knee joint. An interesting fact about hamstrings are hamstring strains are among the most common injuries in sports that involve sprinting and jumping. Exercises that include knee flexion will be prone knee flexion. Lie on your stomach or your side. Bend your knee as far as possible. For more flexion, you can grasp your foot and pull towards your buttocks. Another exercise that includes knee flexion would be the Nordic hamstring curls. To perform the Nordic hamstring curl, attempt to keep a straight line between your knees, hips, and shoulders as you slowly lower to the floor or object in front of you. You'll then catch yourself with your hands and push back up. Here is a proximal base hamstring exercise, Romanian deadlifts. Stand up tall with your feet shoulder width apart and hold a dumbbell in each hand. Push your hand back and lower the dumbbells while keeping your legs straight or only slightly bent. Return to the starting position and repeat. Here's another proximal base hamstring exercise, single leg raised bridges. Lie on your back with your knees bent and feet flat on the floor. Lift one knee to the tabletop position. Press through the foot that is flat on the floor to lift your hips off the ground. Pull your abdominal muscles to prevent your back from arching. Return to your starting position. The next muscle group is the pectoralis major. The pectoralis major originates from the clavicular part, which consists of the clavicle, the sternocostal part that consists of the sternum and the costal cartilages 1 through 6, and the abdominal part which consists of the rectus sheath, specifically the anterior layer. It inserts at the humerus, the crest of the greater tuberosity. It performs the actions of adduction and internal rotation. Interesting fact about the pectoralis major is tendon tears occurring almost exclusively in males between 20 and 40 years old, and around 5 of these are sustained during weight-bearing exercises such as the bench press when the arm underload is in extension and external rotation. Exercises that can be used to activate and strengthen the pectoralis major are push-ups. With your legs extended back, place the hands below the shoulders, slightly wider than shoulder width apart. Start bending your elbows and lower your chest until it's just above the floor. Push back to the starting position. 1 second push, 1 second pause, 2 second countdown, and that's the most ideal way to do a push-up. Another exercise is plank get-ups. Slowly lower your right arm until the forearm is flat on the ground, then bring down your left arm. Once both forearms are on the ground, immediately raise your right back arm up to push-up position followed by your left. To stretch the pectoralis major, you can do chest openers. Stand or sit up tall, hold both arms in front, hands palm to paws. Inhale deeply and smoothly draw your arms out and back. Take in several deep cleansing breaths and feel your chest and shoulders open. Squeeze your shoulder blades together as you breathe. Another exercise that can stretch the pectoralis major is walk up the walls. Start with your hand at shoulder height and gradually walk your hand up the wall until you feel a stretch. Repeat on the opposite side. Finally, you have the subscapularis. The subscapularis is one out of the 4 rotator cuff muscles. It originates from the subscapular fossa. It inserts in the lesser tuberosity of the humerus. It performs the action of internal rotation. An interesting fact is that the subscapularis is the largest, strongest muscle of the rotator cuff. The rotator cuff muscles are essential in shoulder movement and help maintain glenohumeral joint stability. The subscapularis muscle lies at the anterior surface of the scapula. An exercise to help strengthen and lengthen the subscapularis would be the towel stretches. Stand straight, and you can use a towel for the stretch. Hold one end of a large towel in your left hand and reach over your left shoulder. Grab the other end of the towel behind your back with your right hand. Slowly lift your left hand overhead, allowing your right hand to slide up your back. You should feel a stretch.